what doctors face in their day-to-day life today, it is an ever-increasing burden of administrative tasks. And there is an opportunity today to take a lot of that administrative task and have AI-based tools do that. And what it could do potentially in an era where a lot of doctors are facing burnout, it can give them back the time and enable them to spend that time with patients. Every C-suite decision that is made in the context of healthcare, I think that level of empathy with realities that are faced on the front lines of care, and oftentimes they are dealing with these issues at 2 o'clock in the morning with very little support around them. I think that has certainly positioned me better. Increasingly, healthcare is facing a workforce shortage. That is true across the planet. So we need to be able to do better and more with less. And this is, I think, where AI will play a significant role in how we deliver healthcare.
Hello and welcome to another episode of The Shift, powered by ET Edge Insights. It's a platform where we sit with key industry leaders to deliberate key issues that change the world around us. And today we have with us Dr. Madhu Sasidhar, who is the CEO and President at Apollo Hospitals Group. Dr. Sasidhar, welcome to ET Edge Insights.
Thank you so much.
All right, really curious to know about how we are reimagining the healthcare space today, given that there's intelligence systems kicking in, there's data-driven decision-making that's kicked in.
Yeah, so if you look at the current breed of artificial intelligence-based technologies that are becoming available, especially around generative AI, large language models, and agentic AI, I think these technologies will fundamentally change how we deliver healthcare, right? We are experimenting with many of these technologies. The early experience suggests that they will both improve the efficacy of how we deliver care, so more accurate care, more accurate diagnosis, but also substantially improve the efficiency of delivering care. And that is very, very important because increasingly healthcare is facing a workforce shortage. That is true across the planet. So we need to be able to do better and more with less. And this is, I think, where AI will play a significant role in how we deliver healthcare.
Right. Given that healthcare is increasingly becoming tech-enabled, how do you ensure going forward that innovation does not come at the cost of empathy?
I get asked this question a lot, which is once AI comes in and you infuse more technology, does that make healthcare less empathetic? In fact, I think if we do this right, the answer could be the exact opposite. I don't think it is a trade-off between technology and empathy. In fact, if you look at what doctors face in their day-to-day life today, it is an ever-increasing burden of administrative tasks. And there is an opportunity today to take a lot of that administrative task and have AI-based tools do that. And what it could do potentially in an era where a lot of doctors are facing burnout, it can give them back the time and enable them to spend that time with patients, more time with patients, doing what they do best, which is guiding patients through complex care. In fact, I really do believe that the current suite of AI tools will actually restore humanity to medicine and to doctors.
Right. Interesting. Dr. Sasidhar, India's healthcare landscape is vast. It's also unequal. What scalable strategies do you think can deliver quality care without compromising equity?
Yeah. So I think there are several technologies that will come together, right? It's going to be several technologies, including hardware-based ability to get patient data and transmit it across distances, right? Telehealth, but also the ability to layer AI on top of that. It'll be the confluence of these that will both improve access and reduce the barrier to care. I'll give you a few examples. It used to be that chest x-rays had to be obtained, stored as physical copies and read locally. Now, of course, we don't have enough chest radiologists in India to read all of these chest x-rays, and tuberculosis is a significant public health problem. But now think about the ability to digitize it and have an AI-based solution that can segregate normal from abnormal chest x-rays and only have the abnormal ones read by a radiologist who's sitting remotely. I think these are the kind of technologies which will reduce the barrier to entry and provide care to a much larger population such as in India.
Right. Interesting. Now, you've been a frontline physician yourself. Today, you're a C-suite leader driving strategic decisions. How have these two experiences shaped your mindset when you think about hospital operations and reforms, more importantly?
Yeah, so I think it has certainly made me much, much more empathetic to the needs of both patients as well as caregivers who are on the front line. Every C-suite decision that is made in the context of healthcare, I think that level of empathy with the realities that are faced on the front lines of care. And oftentimes they're dealing with these issues at 2 o'clock in the morning with very little support around them. I think that has certainly positioned me better. And I do miss the bedside care, but I think in terms of the ability to make an impact, I'm really privileged to have this position now, but I'm able to help our healthcare workers on the front line deliver care more effectively and more efficiently.
Now, given AI and data analytics have gained a lot of momentum in the past 5 to 10 years, what guardrails do we have to have in place to ensure the outcomes are responsible?
One of the things that we will figure out is that AI is definitely not infallible. For us, the standard should be at least as good as an expert physician or better in this narrow roles that AI performs in. I think the issues will be around portability of these data and the models. What works very well in one context may not work well in another area. And keep in mind that even when you take India, it is a very highly heterogeneous population with very different patterns of disease, very different lifestyle and genetic risk factors. So I think we have to make sure that we understand that some of these models may not be portable. So governance is going to be very important. And in many ways, I think we will have to govern some of these models just as we govern physicians. When we recruit a physician, we have all kinds of mechanisms to make sure that the practice of medicine is within guardrails, and we have to have a similar mechanism of governance for some of these AI tools as well. Currently, when we deploy these tools, we use this model of human in the loop. So no AI tool directly modifies or delivers care in any form without an expert physician in the loop. And I can see that for the foreseeable future, that will be the model where AI actually enables a physician to provide the right level of care and is not a substitute.
Thank you so much for this insightful conversation, Dr. Sasidhar. It's a real pleasure.
My pleasure. Thank you so much.